Boleh tanya nama Anda? Isi member? Ya, boleh ya saya tanya when is your first day of your last period? Semalam. Later you take up your step yearly if you have any letters or maternity slash day off. Number for my expression.
Itu saya.
CR at the nation coded 15, SID 100, exercise 10 12. Exposure. The exposure factor is 75, kbp 15 mAs.
This is a Caldwell PA Caldwell fissure. The right and left oblique orbital line to right and left lateral cranial corticals is equidistant. Besides, the lateral cranial corticals to the crista galli is equidistant. Superior orbital fissures are symmetrical too. If this is a Caldwell 15-degree caudate, the precursor region is the superimposed lower one-third of the orbit. Because pyramid is superimposed to the infraorbital rims too. Superior orbital fissure is within with the orbit. The area needed to be included in the Caldwell 15 is the orbital rims, maxillary, nasal septum, zygomatic, and the anterior nasal spine. For the collimation, superior of this radiograph must be include the frontal bone, inferior must be include the mandible, Lateral must be include the lateral cranial cortex, and the CR is axis at the lesion. The angle is 15-degree cowded. There is no artifact in this radiograph. The normal range for the KVP is 70 to 80, and the KVP is adequate because the bone trabecular and the cortical outline of the cranium, crystal, gully, pectus ridges, dorsum cellar can be seen. For the range of the MAS is 15 to 20. The MAS is adequate because the soft tissue can be differentiated with the bone. The A-fuse sinus, bony structure, and the sinus can be seen. There is a marker indicate that this is the right side, but the marker is placed the wrong position, and the marker is not superimposed with the region of the interest. Nasal septum is aligned with the lateral thumb, and the cassette size used is 10-12 inches and lengthwise. There is no patient information in this firm, so in the conclusion, this firm is being rejected because there is no patient information and the marker is wrong position.
Change the picture and add chemical. Okay, exposure factor 75, MAS 20. Okay, check another area. Okay, expose.
This is a lateral facial X-ray. The sella tussica is in profile. The orbital roof, greater wings, EAM, and cranial corticus are not superimposed. And beside that, the mandibular ramis are not superimposed too. So there is a rotation. The MSP of the head is not parallel to the bulky. The IPL line is perpendicular to the bulky. The anatomical structure must be included in this form is cranium, orbit, mandible, frontal bone, EAM, nasal bone, and maxillary. For the collimation, the superior border must be included the frontal bone. The inferior must be included the mandible. Lateral is the nasal bone and the EAM. The CR is at the zygoma, midway between the outer canthus and the EAM. There is an artifact. The normal range for the KBP is 70 to 80. The KBP is adequate because the bony tubercular pattern and the cortical outline of the cranium, histogamy, vitreous region, and the dorsum cellar can be seen. The normal range for the MAS is 15 to 20. The MAS is adequate too because it can be differentiate a firm sinus with the bony structure. There is a marker indicate that this is the right side of the frontal fascia, and the marker is not superimposed with the region of interest. The vertex is parallel to the superior border of the form, and the case size used is at 10 inches in lengthwise. There is no patient information, so in conclusion, I reject this form because there is no patient information and there is a rotation of the patient.